Good day, people. We're here to talk about patient positioning. Okay, so when we're talking about patient positioning, we're going to do a series of videos here. We're going to go through a few concepts. And the first concept is going to be that the table makes stable. And what do I mean by that? I mean that the amount of contact that the patient has with the table, or the amount of surface area from their body that has patient or contact with the table, increases the general stability of the patient, increases the support of the patient. Now we want lots of support, lots of contact area to control the patient's motions so that they're safer. Okay, we're going to go through a few different things. We're going to go through just this general overview, right, where we're introducing it, but we're also then going to show you two visual examples. We're going to show you a visual example with a prop, and then we're going to go forward and we're going to use a patient so that you see this in multiple ways. Using the prop is simply to display the concept, not anything about how this will actually work in a human body. When you place a human body on the table, there's multiple factors. Mobility for one. The prop that I'm going to use is going to be a shoebox, and all that's going to show is the general concept. So here we go. Okay, so here we are. We have the shoebox I was talking about a moment ago as our prop. Shoebox is currently on the largest possible contact surface area with the table, right? So it's on it's essentially on the top of the bottom of the box, which would be the analog to a patient being in prone or in supine. So in this situation, we have a large contact surface with the table, which means that this box is stable. It is going to be difficult to disturb it. So the analog to that would be patient prone or patient supine. They are in the most stable position. If we go ahead and we put this box on the long, narrow side, right, like this, whoops, I'm opening the box, what's going to happen is it is currently lost possible contact surface area. So this position, for the box at least, is essentially the patient being in lateral. So as opposed to them being in prone or supine, we've lost contact surface with the table, which means that we've lost some stability. Right? We go ahead and we put this on the smallest possible contact surface area for the way that this is built. This is the analog to the patient being in seated. Okay, so we've gone from prone or supine, where there's a lot of contact with the table. Okay, so prone or supine. We go to lateral, where we lose contact surface, but compared to seated, which is here, we have more. So we've gone through multiple positions, your general treatment positions, whereby we've changed the amount of contact with the table, and that has created a situation where stability has changed. So again, we go back to the concept, the table makes stable. Okay. The reason we're using the shoebox is simply to have another way to visually and verbally describe this concept to you. So we're going to move forward to actually displaying these concepts with the patient on the table. Okay, so we've already spoken about the different positions with the shoebox. We gave you an example talking about the concept that the table makes stable. So the more contact surface a patient has with the table, the more stable they are. So here we have our patient in supine, and just to show that the patient has a good amount of stability, I'll try to shake the patient. Right, so the patient will shake on the table will actually move just because of the nature of this table. It's not as sturdy as some, but the patient is not going to fall. I can move him around quite a bit. I can shake him quite vigorously, which I wouldn't do in treatment because it's not particularly nice, but the patient is stable. So we're going to move on, and we're going to put the patient into prone in just a moment. And so we showed supine to display the concept that the table makes stable. Now we're showing prone. So prone and supine, because of the amount of contact surface that the patient has with the table, tend to be the most stable. So again, just for you to see the stability, I'll shake the patient. There are some people within the osteopathic profession and other professions that like to use a method called oscillation, so another way for saying essentially rocking or shaking. But the patient is not going to fall off the table. They're quite stable and quite safe. That stability is safety. Okay? So we're showing prone, the patient is stable. We're going to move on and we'll look at lateral recumbent or sideline. So here we have the patient in lateral recumbent, aka sideline, where they have a lower amount of surface area in contact with the table as compared to prone or supine. So in prone and supine, the patient has the most possible surface area in contact with the table, so they're the most stable. Right now we have our patient with the legs straight, which is something that most practitioners wouldn't do. Now it's not always spoken about, but when these legs are straight, the patient is quite unstable. I can rock them around quite a bit. So if I didn't control the patient with my hands, as I'm doing at the moment, it's very likely that if I pushed hard enough, that the patient could roll right off the table, which we don't want. So one of the easiest ways to increase stability when in lateral recumbent is to have the patient bend their legs. So now, we've changed the angle of the legs. There's actually, in essence, almost more surface area in contact with the table, or the fact that it's angled, it actually abates movement. It's more so that it's angled and that abates the movement. So now the patient is more stable. So you're automatically taught to bend the legs when the patient's in lateral to keep them more stable. Regardless of the width of your table, the idea is that the angle of the hip, the angle of the thigh with relation to the thorax or with relation to the trunk will abate motion. It keeps them safer. Okay, so we do have a situation whereby when the patient's on their side, we have lower contact area or lower surface area in contact with the table. When we bend the legs, right, when we go ahead and bend the legs, we change that angle and it abates the motion. Okay, so now the patient is in a seated position. So the last position that we spoke about with respect to the shoebox example, we have the patient in a seated position. So there is a much smaller contact or surface area in contact with the table as compared with prone, supine, or lateral. The patient is mostly unsupported. So if I'm here, you can see that I can shake the patient around in all kinds of directions, and it's not necessarily safe. Okay, so there's less contact with the table, there's less stability. We want to consider keeping the patient safe, controlling the patient, keeping them safe. So the position that the patient's in matters a lot. We'll talk about why we would choose different positions and the advantages of each position in another set of videos, but right now we just want to demonstrate the concept that the table makes stable. So when I put the patient in different positions, we alter stability. Right? So we're just trying to show that for now. So that's just the illustrations, not only with the shoebox, but now with the patient, that the table makes stable. Patients in seated, although their legs are stable, not as stable. Shake them around quite a bit. We don't want that. We want the patient well controlled, and we'll talk about that as we go forward.